What's up, everyone? We're back again. Loners are back. Tell a friend. I'm just kidding. Hope everyone's doing all right.
Welcome back to episode
50. Roll that intro.
Yeah, so we filmed a reaction to the Jim Jeffries gun control video because everyone is always telling us to watch it. I thought we watched it. I don't know why I thought we've seen it until we did watch it. And I was like, oh, I haven't seen this. And then we filmed both parts, and Netflix said, fuck you, and you don't get to react.
Because
so, oh well.
It was actually a great video and we enjoyed it.
I enjoyed
but,
it. Yeah.
I kept trying to find loops, like go through loops to post it, and I kept getting hit with copyright from Netflix. We wanted to also send out like our good vibes for the people in Turkey that
Syria, right?
Yeah. They got hit with 7
earthquakes.
Yeah.
There's like over 20,000 deaths so far, right?
I'm not exactly sure about the number.
Oh. I could be wrong. Don't quote me on that.
Yeah.
I should fact check that. But
I'm not going to say that I know all the details about it, but I do know that it was a very serious event that caused harm to a lot of people, and we just wish the best for everyone over there.
And if you have family there, we truly hope that they're okay, and you're able to contact them and check in on them and stuff, because that's scary. That's like really fucking terrifying.
Yeah, it is.
There's enough going on in the world. Like it's really we forget sometimes like Mother Nature has its own plan too.
Yeah, and honestly, seeing some of the footage of it, it makes me think, and it's sad to say this, but it makes me think if that, knock on wood, that were to happen here, there wouldn't be a sense of community how there is over there.
Is there though? Like we don't know. We're not living there.
Okay, it is a very narrowed perspective because I only see the footage that I'm seeing. But from what it looks like it's like a community coming around when people are getting saved, and like everyone being like there for each other type of thing.
I mean, I would hope so, because those are moments where you just got to put your shit to the side
and say like, we need to help each other. Yeah. Which I feel like here, if that were to happen, and I really hope it doesn't, because California is very susceptible to earthquakes.
Oh, we have so many fault lines.
People would just be like thinking themselves 100% and just like not giving a shit about anyone else.
I think it's 50-50, because I remember during the snowstorms in Texas when their power grid like couldn't keep up with
my
their
dad
heat.
got hit with that.
Yeah, a lot of places that like usually don't get that cold were freezing, and their pipes couldn't hold up, and like their houses were caving in.
Yeah,
there were people in like Florida. There were even people from here who were just like, "Oh, that sucks," and I'm like, what the fuck is wrong with you? Like, these are people. You know what I mean?
You know what else is crazy about that situation? So a lot of the gas companies over there and like the electric companies, they're privatized, so they can profit a lot. And they were pretty much helping people who had more money first.
The more expensive neighborhoods had power. Their power didn't go out. My
dad doesn't live in like a nice neighborhood over there in where I'm from, and he didn't have power, I think, for like 3 days.
Yeah.
And he said it was like freezing.
Yeah. It was like below zero, I think.
Well, not in my hometown. Not in my hometown, but it was cold. It was very cold.
Fucking freezing.
It was
I don't know
20
exactly
or 30,
where,
I think. But
that's freezing.
Yeah. But yeah, and I was.
I mean, for South Texas, that's very cold.
Yeah.
That's crazy.
But yeah, so just want to shout that out. Hope everyone is doing okay too. That's watching. Thank you for tuning in. Just want to say, if you haven't, jump over to our vlog channel, like and subscribe. Subscribe to this one. Put the notifications on. We appreciate you, loners.
Everything he said. Yeah.
So today we're gonna do how Germany's universal healthcare system works, and we can compare it to the U.S. We have noticed that healthcare is a really big topic that you guys seem to enjoy us talk about. I know it's very like, what do you call it? Like an echo chamber when you keep repeating yourself to people who agree.
Yeah, like we're preaching to the choir here. Yeah, it feels like.
Yeah, so hopefully more American people watch this and you guys can get some type of perspective too on it.
Yeah.
But it is interesting to learn more about it, but it also just is like, it makes us realize how far behind we are on this subject.
Yeah. I hate how I obviously don't know how the education system is in other countries, especially like first world countries, but I wish that there was like some type of like humanities class here where you kind of learn
about the world,
structures of other countries and
Yeah.
like what, not their history, but like how today they are doing things like that are different than we go about things. Like not even just in a biased sense, just to kind of bring some type of awareness, you know?
Yeah, I mean,
I
it
don't
would
know.
make sense to do that.
Because these people in high school are like the future leaders. So it's like, I don't know, maybe it'd be nice for these kids to like
Understand
think.
how the rest of the world works.
Yeah.
Yeah.
Because I know in high school, I just assumed most of the world worked the same way it
Me-
did here.
me too.
At least like,
Yeah.
you know.
I thought everything was run the same way.
Yeah.
Yeah.
And I was like, all right, well, if this, like, you know, and I know I've said this before, but you think like, well, if there was a better way, we'd be doing it because we're America. But really, it doesn't feel like
Yeah.
so I don't know. Some people are still in that mindset, and I think it's once you're an adult, it's kind of like your duty to like go and explore.
Yeah.
You
And
know, and
not-
not be so narrow-minded,
Yeah.
and to just think like
Take other perspectives in.
for sure.
Yeah. But yeah, are you ready?
Yes.
Cool.
CNBC video.
Oh yeah, I'll put the original video on down. Cool. All right, let's go.
70% of Americans say the U.S. healthcare system is in a state of crisis or that it has major problems. That's why we're hearing a lot about Medicare for All, including some plans going as far as banning private health insurance companies altogether.
On page 8 of the bill, it says that we will no longer have private insurance as we know it. And that means that 149 million Americans will no longer be able to have their current insurance. That's in 4 years. I don't think that's a bold idea. I think it's a bad idea.
Problem, Senator Sanders, with that damn bill that you wrote, and that Senator Warren backs, is that it doesn't trust the American people. I trust you to choose what makes the most sense for you.
Okay,
Okay, you don't trust us in a lot of aspects, but when it comes to our health,
but do you see how they're like? I don't even know the right word for this. It's not like, it's kind of manipulative, but it's like they make you think that like, oh, I'm so smart because I have all these choices to choose from, and I'm picking what's best for me and all this stuff. When
they put the responsibility on your plate so that if you aren't receiving the care, they're like, well, you chose it.
That's true.
That's what you wanted.
Yeah, that's a good point.
And it makes, I don't know.
And also, it's just like it also just it creates this divide of people getting quality care. That like, if you can't afford a really good premium or health insurance, then you're gonna get stuck having to like really dig for someone who cares, as a doctor or a dentist or anything. You know what I mean?
Yeah.
Whereas if you have more money, most likely you're going to easily go to someone who is technically a better doctor or something like that.
Well, yeah.
That's what I'm saying. But
yeah.
it should be fair across the board with everyone.
Yeah.
Ideally, right? I know.
Yeah. When it comes to your health, it shouldn't feel like it's.
If I pay more, I'll get the extra.
Yeah. Like I know someone who pays $800 a month for health insurance.
Damn.
Well, she doesn't. Her parent does. But like $800 a month.
It's a lot of doll hairs.
Yeah. It's a lot. It's crazy. But I mean, she probably has like the best of the best too. You know what I mean?
Damn. All right.
Could be wrong, but I don't know.
Not my way or the highway.
One country found a way to provide universal healthcare coverage while maintaining a competitive insurance market that offers citizens more choices. Germany. Here's how they did it. In 2017, U.S. healthcare spending came to around $10,200 per capita. In Germany, it was a little under $6,000. Overall, Germany spent about 11.2% of its GDP on healthcare, while the U.S. spent 17.1%. Germany manages to cover 100% of its population. In the United States, about 8.8% of the population remains uninsured. That comes to about 28 million people, with even more people underinsured.
I have a feeling that this has gone up, probably.
Wait, can we do a quick Google search? Like, do you have your phone with you?
Yeah.
I kind of want to know how much.
I can do
is
it.
now.
Yeah, it's fine.
How many Americans are uninsured 2023? I know that technically, legally, you have to be like insured.
So it went up to 9.2%.
I thought it would still be more.
Yeah, so it was 8.8 in 2017, and apparently it's gone up to, so that translates to about 30 million people. Damn. It's a lot of people not insured.
Yeah.
Despite spending less, Germany has better or comparable health outcomes to the United States. Studies show that in Germany, there were fewer deaths that could have been prevented with proper access to care. In 2013, there were 83 avoidable deaths out of every 100,000 people in Germany, while the United States had 112. Life expectancy in Germany is 2.5 years higher than the United States, and the infant mortality rate is lower in Germany, with 3.3 deaths per 1,000 live births, as opposed to 5.8 deaths in the United States. Additionally, the maternal mortality rate in the United States is more than 2 times higher than in Germany. So how does Germany manage to have better health outcomes while spending nearly half as much as the United States?
Germany is a system that would look familiar to Americans in that everybody buys health insurance from a private company. And then the doctors and the hospitals and the labs are almost all private.
That's T.R. Reid, author of the book, The Healing of America. He traveled the world exploring different healthcare systems and how well they worked.
But it works better in Germany for a couple of reasons. One is everybody is covered. Everybody is required to have insurance. Everybody's in the system. The insurance companies can't turn you down because you had cancer last year or something. They have to take you. They have to cover you. Everybody has access to the same treatment, and all the doctors. You can go to any doctor without any limit set by the insurance company.
In Germany, health insurance is mandatory for all citizens and permanent residents. There are 2 different systems that residents can turn to for insurance: SHI, which stands for Statutory Health Insurance, and PHI, or Private Health Insurance. German citizens are eligible for PHI if they make more than roughly $60,000 per year, or if they are self-employed. Citizens making under that threshold must pay into SHI. SHI is made up of a network of competing not-for-profit private health insurance funds, known as sickness funds. In SHI, dependents are covered free of charge, and monthly costs are capped around €840 per month. Even though SHI sickness funds are not government agencies, many Germans think of them as part of a public system because of heavy regulation. Keith Tanner helps expats navigate the German healthcare system, and he considers SHI sickness funds quasi-public organizations.
Did you see the most expensive one? That's still pretty expensive, but it said for the highest earners.
It's like 800 something.
Yeah.
I mean, like, that's expensive.
It is, but I wonder what they consider the highest earners. It's probably pretty wealthy people.
They just said if you're making more or less than 600. I mean,
60,000.
Sorry.
Yeah.
Basically, they have to do what they're told. They are told by the government in what range they can charge. They're told what health procedures they can fund, and they are told by the government who they can accept as clients. So they're really just carrying out orders.
They're basically charities. They don't exist to make a profit for investors like American health insurance companies. They're there to keep people healthy. That's what they're there for. They follow all sorts of rules that American insurance companies wouldn't dream of.
The system is funded through compulsory contributions based on a percentage of citizens' salaries, with employers sharing the costs. There are also built-in safety nets. The government will pay into SHI on behalf of the long-term unemployed. Despite being non-profit organizations, sickness funds compete for customers by offering specific coverage and perks. This competition has changed over the years as the system has allowed citizens more choice. As of 2019, there are about 100 statutory health insurance companies, but there used to be many more. When Germany's system was first established in the late 1800s, sickness funds were linked to a person's profession. It used to be that people were assigned to...
That word looked insane. It was such a long word.
Yeah. It seems like here the insurance companies are fighting for your, like, quote-unquote business. I could be wrong. Versus here, it's more like...
We have to fight for the better...
Yeah. Or like... Or they play it like, well, if you want us, this is how much we're going to be. Like, they're playing hard to get. I don't know. That's just what it seems like.
It sounds like the government gives these insurance companies incentives. The more people that they cover, you know what I mean?
Talk about in Germany?
Yeah. So here, I don't think there's anything like that. So it's pretty much like it's free market. So
It's
they can
pri-
just be
yeah.
like,
They can do what they want.
yeah, exactly.
Assigned to a specific sickness fund based on their occupation or region. Now Germans can choose where they enroll, and they can change funds on a yearly basis. As a result,
Nice.
sickness funds began marketing themselves in order to retain customers and attract new ones. This also led to the funds merging, so they could become more competitive. Some of the sickness funds offer perks that might seem similar to credit card rewards.
You still can get a bonus for going to the gym, and a bonus for having a checkup. This is in the public
Wow.
system. And if you get a certain number of bonus points, then you get a voucher. But kind of trivial stuff like 200 a year or something like that. 200 euros a year, nothing which is particularly relevant to the person who's paying their 840 a month.
As of 2017, roughly 87% of Germans received their primary coverage through SHI and 11% of the population through PHI. The remaining population, such as soldiers, police officers, and refugees, receive health insurance through specific government programs. All individuals insured through PHI pay a risk-related premium with separate premiums for each dependent. These risk-based premiums mean that costs will increase as the insured gets older. As a result, the government regulates PHI so people don't become overburdened by premiums as they age.
The biggest issue with private health insurance, if you opt out of a public system, is affordability in old age. If you don't impose these financial constraints on the insurers, then the government will be lumbered with a whole lot of old people who reach 85, 90, 95 and are going to be totally unable to pay for their health insurance. So it'll all fall back on the government.
Once someone switches to PHI, they cannot switch back to SHI in the future. But Tanner says there are ways around that.
If you're a freelancer in the private system, you're just going to get a job. Paying less, there's a threshold. Any employee.
That's weird though. Like if you're on PHI, like knock on wood, something happens to your business or your job, and like I feel like yearly it should be re-evaluated. Like
Yeah,
they
that
said
would
you
make
can
sense.
change your provider every year if you are on SHI. Why can't on PHI you can? They check your income now and they say, okay, like
Yeah, that's weird.
that's weird.
It is.
Earning under about 5,000 a month is required to have public. If they earn more than that, they can opt out. So if you are a freelancer, you want to go back into the public system for some reason, then you get a part-time job with a friend, pays you 500 a month for a few months, and then you're back in the public system. So there are ways to do it. The only reason you probably want to
Sound
do
like a
that, though,
loophole.
is if you have lots of children, because children can be covered free in the public system. In the private system, you have to pay.
I wonder
Separate.
if like one of the parents, like if you live in a household, like 2-income household, if like say the mom makes like 80,000 and the dad makes like 55,000, so like I wonder if he can claim the children so that they can get the insurance. I would assume that would be the
Yeah,
smartest
that's a
way.
good question.
Just
For each child.
Or does it
Germans
go by
can also
household?
buy supplemental private insurance while staying in SHI. For example, many Germans buy supplemental dental insurance.
The public system pays like for major dental work about half the cost, and then you get supplementary to take it up to 80-90% of the cost.
Germany's system
Wow,
is
wait.
not perfect.
So the public system also pays for major dental procedures.
That's what
50%.
50, yeah.
Yeah. That's crazy.
How's that crazy?
I mean, like, that's good.
Yeah. I mean,
That's
dental
wild.
is health. I'm sorry. It's
I
all
know.
connected.
I know. It's just here, I feel
Here
like,
they don't take it as serious. Like,
here you look at dental like a luxury, like we were saying earlier.
yeah, like, but a lot of issues that can stem from like lack of dental care can
It
lead
goes to the
your
rest of your
heart,
body, yeah.
brain, yeah.
I think we
crazy.
underestimate that here, especially, but
No, they don't. They just don't care. Like, they see that they can make. It's just another way for them
Yeah.
to
because
make a lot more money.
major dental procedures here in the States, they're very expensive if you don't have insurance. Even with insurance.
Some
Yeah.
insurances, like the average insurance probably covers maybe like $1,000 a year. So if you get
Yeah.
like a root canal, there goes pretty much your.
Root canals are like $1,000
I think
bucks.
they're like $500, maybe $700. But then you get 2 cleanings a year, which are, also between $100 and $200. So it's like
Yeah.
to some, I just feel like the most that it'll cover is like not enough to work.
It's not.
If you, yeah.
With the price of how much things
I think
are.
for kids though, like dependents and stuff, it's pretty reasonable
Yeah,
if you're on top
yeah.
of it. But
I think if you're under like 14 or something, that's when it starts to get a little more expensive. Because like orthodontic stuff, I think when you're under 14 is a lot cheaper.
I think you're right. Yeah, maybe.
Yeah.
I don't know.
Is not perfect. With so many different insurance companies, there's a lot of bureaucracy that contributes to costs.
One of the financial things, thinking if the public system administered by more than 100 organizations called Krankenkasse, each of those has a head office and a president and a vice president and a financial officer, and a whole lot of unnecessary bureaucracy.
This may be one of the reasons that the German system is not as cost-effective as other European countries. More than 30% of both Germans and Americans felt bureaucracy was a major issue in their country's system. Wait times can also be an issue for people in SHI. 37% of Germans cite wait times as one of the biggest problems within their system, while 22% of Americans feel the same.
I really want to know, when you go to the doctor, if you're from Germany or you live in Germany, how long is a wait time? Like,
average,
whether it's urgent care, primary care, or ER. Like, I want to know the actual wait time.
Well,
because, sorry, what were you saying?
No, go ahead.
Because, I mean, I've dealt with it all. I've dealt with an experience where I get seen right away. I've dealt with experiences where I'm waiting 3-4 hours. I've dealt with, ask him, I got a call yesterday about a doctor appointment that they were trying to reschedule for the third time.
Yeah.
Telling me, we got to push it again. And I was like, you're not pushing it. Like, I'm not doing this anymore.
Yeah, I know.
Either
it's kind of ridiculous.
Yeah, and I'm like, this is under insurance. Yeah. So, I don't know.
It is kind of crazy. But I think in other countries, when you like the public system for sure, I think they take what's most important first.
What do you mean?
Like if someone has something that's dire, like they cut their finger off or
you're talking
something.
About emergency room. Yeah, well, that's different.
Yeah, I guess when you're just going for like a checkup or something like that. Yeah, I don't even think they have. They said they don't really have checkups in other countries. Remember in one of the other videos, they said because they only really go when it's necessary. They don't like. Apparently, you don't really need the checkups.
I can see how checkups could be like kind of. But then again, like I don't know. I don't know how many people during a checkup are finding things that are.
That's a good question too. I don't know.
That are like dire. They're like, oh my god, like good thing I came for this checkup. But I also don't know.
It's probably a small percentage, but they probably different. Do. Yeah. I don't know. But if you know the wait times, let us know.
I do want to know. I'm curious about that.
Americans feel the same.
Generally, I think people are quite happy with the public system. It works reasonably well. The major issue in big cities, I'm in Berlin, Munich, Düsseldorf, Hamburg, it can take quite a while to get an appointment with a specialist. It is the case that the doctors prefer the private patients because they earn up to 3 times more if they see a private patient.
Yeah.
It's wild.
So what can the United States learn from the German system? Germany has managed to balance cost controls and universal coverage while also maintaining competition. And Germans generally like their system. In one survey, not a single German said they had to wait more than 4 months for an elective surgery, while 4% of Americans said that they had to wait that long for the same kinds of procedures. And only 7% of Germans said they experienced a barrier to care because of cost in the past year, compared to 33% of Americans.
Citizens really like it. They like the fact that everybody is covered.
Yeah.
They like the fact that the costs are totally predictable. You know what it's going to cost you and how much your insurance company is going to pay you before you walk in, unlike the United States.
Yeah.
They think it's normal that the insurance company pays every claim. They can't believe that an insurance company might deny a claim. And they think it's normal that they get to...
Yeah, like here, there's like a negotiation process between the hospital and the insurance.
Yep.
And I know most hospitals aren't fighting for them to pay more because it's not going to come out of their pocket. They just get to charge the patient more.
Yeah.
It's really weird how that works. So
I'm sure there's a lot that goes into that.
There are these videos going viral for a while on TikTok of people like having huge medical bills out here, and they would ask like the insurance company, they'd be like, give me an itemized bill, and like a lot of them wouldn't give them because they're like, there's no standard price for a lot of these things. They kind of just like do what they feel
it would also
is like necessary.
Yeah, it would also probably show a lot of unnecessary transactions on there, like a lot of stuff that's just like this fee, extra bill, or extra fee, this fee, insurance fee, or this blah blah blah.
Like nonsense.
Yeah,
it's just wild.
Yeah.
Choose the doctor. They don't understand America, where the insurance company says we won't cover Dr. Jones. You have to go to Dr. Smith instead. So the main thing I learned in going around the world is you have to make the commitment to provide health care for everybody. That's the destination. It turns out there are many different routes to that destination. I found, the Canadian model, the French model, the British model, the German model, they all get to this goal in different ways and different models. So I don't care what the model is. I think it's important that you make the commitment to cover everybody. And this is something the world's richest country has never done.
Yeah. Yep. Good points there, my man. No, but honestly, like, it's so true. Yeah, I don't know.
Yeah, I agree. I mean, I feel like Germany's kind of doing it the same way a lot of other European countries.
Well, no, I feel like they're different because they still have the private part. Some of them don't have the private part. Maybe they do. Maybe they do.
I really don't know.
Yeah, let us know wherever you're from, because I know in certain places you can opt into a private. Obviously, you'll get like faster treatment. There's less people.
It's more expensive.
Yeah. I know. I heard Switzerland, and I also saw in there too. It's pretty expensive.
And New Zealand too, I think, kind of looked like there was.
Yeah.
But if you are from Germany or have lived there for a while, kind of want to hear your opinion.
Let us know.
On
Leave
how your experiences are going to the hospital.
Yeah.
Whether it's for like a checkup or emergency.
Yep.
Like, I'm curious. I do like that he was saying though, like they know what to expect. They just know insurance that's what they're there for. To cover these like experiences. They're not supposed to.
It'd be a nice feeling, huh?
Yeah, you shouldn't think about going to the hospital or for anything and being like, okay,
how am I gonna pay this?
It's gonna cost me,
or
feeling like your health is being negotiated between your care provider and Max is snoring.
I know.
And your insurance.
It's true. Yeah. Interesting video. Yeah. CNBC has pretty good stuff. We've seen them a few other times too. Yeah. Other videos. But yeah, we hope you enjoyed that one. If you did, don't forget to like and subscribe.
And if you didn't, just like and subscribe.
Yeah. Do it either way. All right. Jump over to our vlog channel too.
Thanks to everyone who has been watching us since we had like 100 people, and Brian would wake me up in the middle of the night and be like, babe, we have another subscriber.
We appreciate you guys, and we hope you enjoy the content.
Yes.
All right.
Bye.
Peace out, loners.